Hi, I am Joanna and I am pharmacist.
Hi, I'm Jakub and I'm psychologist.
In the last couple of years, both of us were working in the field of drug education, drug checking, psycher and other harm reduction activities in recreational settings, as you see in Poland and abroad. And this work inspired us to perform a short research which would allow us to answer some bothering questions in a scientific manner. Title of our research project is Drugs, Mental Health and Harm Reduction. It was performed in 2020 and will end in December 2021. Project is supported and funded by National Bureau of Drug Prevention in Poland. We have twofold goals. The first, Jakub's goal, is to examine the relationship between harm reduction strategies and negative substance-related consequences. In simple words, we want to check if harm reduction strategies really reduce harms. Main goal will be to analyze self-medication phenomenon. Self-medication is using of psychoactive substances to alleviate symptoms of mental health disorders. And this study was performed among adolescents and young adults who use various psychoactive substances, excluding caffeine, alcohol, and nicotine.
As this is only a 50-minute talk, we will need to provide you with the highlights of our results. But first, let me introduce you briefly to our study method and participants. We have collected our data through a self-administered online questionnaire, which covered the range of subjects regarding patterns of substance use, harm reduction strategies, substance use disorders, self-medication, mental health problems, and as well as some questions on an influence of COVID pandemic. This questionnaire was disseminated on websites, forums, and Facebook groups that were frequently visited by people who use psychoactive substances in Poland. And we also had a promotional support of a famous local drug education influencer who encouraged people to take part in our study within the scope of his YouTube, Facebook, and Instagram content. And the cooperation with this influencer worked very well for us because more than 10,000 people participated in our study. However, after excluding those with predominated missing data, we have left with over 7,000 participants aged between 18 and 30 years old who have been using various psychoactive substances in the last 12 months. Among them, 1/3 were females and 1.3% checked other as a gender. And one interesting note is that we managed to collect a sample diverse in terms of a place of residence. So people living in cities, towns, villages, and so on. Regarding substance use among our study participants, as you can see on this chart, 1/3 did not exhibit any substance use disorder or SUD symptoms. However, the rest of them were likely to exhibit moderate to severe SUDs, which is based on standardized screening test, drug use disorder identification test scores. Jumping to my part of this project regarding harm reduction strategies and substance use disorder, let me first put this research into context a little bit. So first of all, substance-related consequences do not depend only on substance chemistry or physiological mechanism of action, but on many different factors, including individual patterns of use. It is assumed that these adverse substance-related consequences are not inevitable. Prevention strategies that are focused on abstinence as a goal are limited in their effectiveness and may not be appropriate for everyone, which creates the need for different strategies as well. And harm reduction strategies, according to their definitions, are specific behaviors that may be applied before, during, and after substance use in order to reduce adverse consequences. Previous studies on these strategies were limited to specific substances, settings, or study populations, which is why we decided to focus on non-substance specific or general harm reduction strategies in our research. The prevalence of applying these strategies among our study sample was very high. As you can see on this chart, almost all of our participants reported employing harm reduction strategies within their substance use situation in the last year before the study, with 2/3 of them doing so usually. And on the right side, you can see examples of particular strategies that were used the most and the least often. Here come some statistics. We conducted ANOVAs in order to examine differences between the severity of substance use disorders based on DUDIT scores and the frequency of using harm reduction strategies. And our analysis showed that these differences were statistically significant with quite a large effect sizes, meaning that participants who used harm reduction strategies more frequently were less likely to have substance use disorder symptoms, and that those who were rated as likely to have SUD were using harm reduction strategies even less often. And on the right side, you can see very similar analysis, but with gender included as a second factor. So this is two-way ANOVA. The relationship here is very similar, but this analysis indicates also that gender had significant associations in this equation, though its effect size was pretty small. However, the interesting part is if you can take a look, if you can take a closer look to this red line, the interesting part is that among participants who scored as likely to have SUDs, males seem to use harm reduction strategies more often than girls, than females, which is exactly the opposite situation that among those who probably did not have any SUD symptoms. And you know, this is a very interesting correlation that we will certainly need to explore further. But overall, these results may not be very surprising for some of you. Unfortunately, more sophisticated analyses were beyond the scope of this presentation. And now we need to jump to the second part. So let me invite you to self-medication phenomenon.
Okay, so let me tell you a little bit about the background of self-medication phenomenon and my research. There is high comorbidity of mental health disorders and substance use, because almost 20% of people with mental health disorders abuse psychoactive substances in some way, and vice versa. There was even one research when 51% of people which had mental health diagnosis in some point of their lifetime also had a substance use disorder problem in the same moment or other moment in their lifetime. So that's why self-medication theory appeared. And also self-medication is a risk factor for substance use disorder. And there is also other side of this phenomenon, because some psychoactive substances can be also used as medicines. For example, stimulants can be very good medicines for ADHD. And bupropion, which is from cathinon's family, is effective to treat depression symptoms. Also, some illegal substances are now investigated as potential medicines. For example, MDMA for PTSD and psilocybin for treatment-resistant depression. Some about results. As you can see in the yellow box, among participants, 26% had a mental health diagnosis. It was 1,700 people. And women had a diagnosis much more often than men. It was 45% of women and 18% of men. Among diagnoses, depressive disorder was the most common. It was 74%. Anxiety disorders had 50% of respondents, and substance use disorder had 22%. Other disorders were much less prevalent. Below 20% of people had other disorders. Also, what is interesting, 34% of people had 3 or more diagnoses, which can indicate that these people are going to multiple doctors, are had different medicines prescribed, and are hard to treat. Also, some people can suffer from mental illnesses but are not diagnosed. And these people were excluded from further research. About results of self-treatment effectiveness, I have done this basing on depression. I had over 1,300 people with diagnosed depressive disorders, and 91% of them were treated conventionally by prescribed medicines and or psychotherapy. And as you can see on the chart in this white box, 59% of people which was treated conventionally were satisfied or highly satisfied with this treatment. But 73% of diagnosed people with depression was trying psychoactive substances to self-medicate. And as you can see on the chart, some psychoactive substances also showed high effectiveness in depression treatment, basing on people's opinion. The most effective were psychedelics, 73%. And psychedelics were also used very common, the same with marijuana. And why psychedelics were so popular and so effective? Maybe this is because of this, that psychedelics are described now in media in a very positive way, and maybe these people were biased positively about them. But maybe psychedelics really help them, I don't know. And also people which were trying to self-medicate have had higher DUDIT scores, which means that these people are more vulnerable to have substance use disorder. Also, we performed our research during COVID pandemic, and we know that pandemic can affect on our results. But as you can see on this chart, maybe this influence wasn't very high, because most of the people thought that COVID, there was no influence of COVID on their substance use behaviors. Maybe they used a little more often substance and a little more often applied harm reduction strategies. But what is interesting, 21% of people experienced less harms during COVID. Maybe this is because lack of recreational settings. They can't go clubbing or meeting friends so often. Thank you very much for your attention.